So a lot of people get it done thinking it's a short-term solution to a chronic problem.
Correct.
And that's where the folly is, right? Obesity is a chronic disease. Quite often we see someone who's put on weight, oh, ye to mota hai, ye to exercise nahi kar raha ho.
That's the first perception that people form.
And that stigma actually is so pervading that eventually the individual himself or herself starts believing that weight is my mistake. See, it's perception, right? Your show says perception.
Yes.
It's what is perceived. Every individual starts blaming themselves for their obesity, when actually it should be way beyond that. They should actually, if a obese person lifestyle, perception and beyond should be their caption.
Absolutely.
Right?
Welcome to another transformative episode of Perception and Beyond, the podcast where we explore the ideas, breakthroughs, and pioneers shaping new realities. Today's guest is none other than Dr. Mufazzal Lakdawala, internationally renowned bariatric surgeon, digestive health expert, and founder of the Digestive Health Institute, Mumbai. Dr. Mufi is fondly known as, is a trailblazer in weight loss surgery, metabolic wellness, and advanced digestive healthcare. From leading innovations in minimal access surgery to being honored globally for excellence in bariatric surgery, his work has helped thousands reclaim their health and lives. In today's episode, we'll bust common myths around obesity, Ozempic, gut health, and real science behind sustainable weight loss. If you are curious about how your gut health influences your entire well-being and what it truly means to fight obesity holistically, you are in an eye-opening conversation. Let's get started, and we are here to start our conversation with Dr. Lakdawala. Hi, Doc. Welcome to Perception and Beyond.
Thank you so much.
Wonderful having you here.
Thank you.
Just want to understand what is bariatric surgery, first of all, because a lot of people have different understandings and misconceptions and probably thought processes around this topic.
So bariatric surgery actually emanated from a word baros, which is a Latin word for weight, right? Bariatric surgery, the classical and true misconception of bariatric surgery is it's a cosmetic surgery.
Right.
And that's what it's absolutely not. Bariatric surgery is probably the most effective treatment that we have today medically for significant clinical severe obesity.
Mm-hmm.
Yeah, obesity that brings along with it and is a harbinger of various medical problems, from type 2 diabetes to hypertension to heart disease to stress urinary incontinence to infertility to gout to osteoarthritis, and the list goes on and on. Yeah, so it's like a tool, and we all know that if you have a nail in hand and everything looks like a hammer, right? So bariatric surgery is meant for only those people who really benefit from it. So it's definitely not cosmetic. It's not meant for floozy weight loss of 5 and 10 kilos. It's meant for serious long-term solutions of weight wherein your diabetes is worsening when you're significant, and it produces significant impact on your long-term life, on your quality of life, and various studies have shown that diabetes remission, sleep apnea remission, infertility remission, as well as mental health, quality of life indices improve after bariatric surgery.
So does that mean that somebody who thinks that they want bariatric surgery should have A, B, C, D symptoms and then they qualify for bariatric surgery?
World over guidelines have been framed, right? So most of us have, a lot of the guidelines are now undergoing transition because we've got a lot of metabolic or non-communicable health diseases that are coming on. But majority of these guidelines are basically based out of BMI.
Mm-hmm.
So in India, as we stand, the guidelines currently say that if you have a BMI of above 32.5 with type 2 diabetes or one of the other comorbidities, serious heart issue or sleep apnea or osteoarthritis, then you become a candidate. If your BMI is above 37.5 and you don't have any of these, you still become a candidate. So far, the Insurance Regulatory Authority of India has approved a BMI of above 40 without comorbidities, and you can still get bariatric surgery.
And is this like a male-centric surgery or a female-centric surgery? Is there any kind of a, because a lot of people have this myth that, only men go for bariatric surgery. Is that correct?
Actually, the if you look at my data, it's almost 50-50. We operate.
Okay.
So we operate across age groups, right? I don't like operating on the adolescents because I feel that unless they really warrant or unless they really need the surgery, you should try and avoid surgery on adolescents. But yes, in all age groups, starting from the 20s, where women who do it mainly because they put on weight, infertility, and various hormonal issues that kick in, insulin resistance and various other things. From menarche it starts and then it goes on. Men usually start getting it done a little later because men are okay with being slightly on the heavier side when diseases kick in. So around the mid-30s is when type 2 diabetes, hypertension, everything kicks in. So that's when their numbers usually peak. After 50, women who undergo menopause, they suddenly see the surge in weight gain. They tend to get it done. Men again after that age. And what happens is knee pain and backache. A lot of the good orthopedic surgeons nowadays recommend that patients undergo surgery prior to the knee replacements because when they are very heavy. So across age groups we've operated, and the reasons are usually different for different people. One thing I've not done in my entire career of close to 20 odd years with bariatric surgery is never operated someone who I believe is doing it for cosmetic reasons.
In fact, I wanted to ask you this only, that a lot of people now, because they have body image issues, does this become like a shortcut method for, just overnight thinking that, okay, I'll go for this surgery and then tomorrow my life will be different?
So a lot of people get it done thinking it's a short-term solution to a chronic problem.
Correct.
And that's where the folly is, right? Obesity is a chronic disease. It's a disease. World bodies have recognized it. Today we've had Lancet that has published a paper defining obesity as a disease. When it's a chronic disease, how do you get short-term solutions to that? It's impossible. Whoever does operate someone thinking that, okay, yes, you'll get short-term outcomes. Like any short-term fad with diets or anything, you go on a low-calorie diet, you lose weight. Do you maintain it? No. Long-term lasting health effects is the goal of bariatric surgery. That's why it's very, very vital that you go to the right people who recommend the right things for you.
And you have been a surgeon for over decades now. Have you seen any kind of a rise in the number of cases that have started coming to you over a period of time? The obesity rate has increased from last couple of years, or you think that it has reduced drastically?
Obesity rates have gone up. For example, I'll tell you, Lancet in 2024 published some data. It said that between 5 to 19 years of age, the adolescent and children of India, in 2022, the survey said that we've got 12.5 million people afflicted with obesity. In 1990, those figures were 0.4 million. So that's the rise.
Wow.
It's gone from 0.1% in males to 3.9%, from 0.1% in females to up to 3.1%. And that shows the Honorable Prime Minister recently put out a statement on his fight with obesity. That shows there's a lot of lacking in terms of societal awareness, in terms of public health perceptions. Majority of healthcare in India so far today, healthcare budgets have been dedicated towards acute emergencies or towards undernutrition, right? We've struggled with undernutrition, and that's India's problem. Now we've got the burgeoning epidemic of obesity and non-communicable health diseases. On the other hand, we also have undernutrition we have to tackle with. Somewhere we have to understand that a lot of obese people are also malnourished.
So is there any kind of a lifestyle problem where this issue emerges, the obesity issue or the concern where people have started putting on weight and they've started becoming obese, or this could be just purely health-related problem?
Lifestyle has a huge role. Like obesity is a chronic disease with multiple interplay of various factors, right? From genetics to socioeconomic conditions, to metabolic diseases, to neurobiome, to gut health, to mental health, and various other things. Now, which factor plays a more significant role in which individual is very, very hard to predict. And that's why we don't really have one cure for obesity. And that's the chronicity and why it plays. I do believe that today we are far better off than we were years back. We didn't really have too many solutions other than saying diet and exercise. Remember that to maintain your weight, it is very, very important to have a long-term solution and planning, right? Any short-term solution does not work. And the most important thing to remember is that it's like a marathon. So when you're looking at running a marathon, you don't prepare for a 100-meter race.
True. And when we talk about gut health, it's become such a common phenomena. Everybody's talking about gut. And so what is the correlation between your gut and your overall health? Because I think largely a lot of people talk about that everything has got to do with your gut.
It's absolutely correct. That's 100% true. The central nervous system is directly interlinked with the enteral or the gut nervous system. Okay. So I'll tell you, they continually send signals to one another. For example, the gut has got 100 trillion bacteria. Okay. Now how these bacteria play up is, in my mind, a huge role to play with various diseases of current lifestyle related disease. For example, if you have things like bloating, gas issues, constipation, diarrhea, it's all linked to your gut and how these bacteria, like for example, if you're stressed, right, that produces a change in your gut bacteria, or the gut bacteria produces chronic inflammation, which can further lead to anxiety, depression, and various other. It's called dysbiosis. As long as you can maintain that healthy interplay, antibiotics. Today we've come with brilliant antibiotics, but they also have a huge role to play in altering your gut. And therefore, I think if you pay attention to your gut, a lot of your current problems will get resolved.
And what about the short-term solutions like having antacids and, taking care of your constipation because you have laxatives easily available? So does that not solve your problem on a day-to-day basis, or that actually increases the risk of, having chronic disorders later on?
No, you're attacking the sign or the symptom. You're not treating the pure cause. The pure cause is, you'll realize that hitherto you never had intolerance to, for example, wheat or to milk. And suddenly you develop this intolerance. When you do these food tests, you suddenly have, that's all because there's a huge interplay between your mental health. You've not slept well, or you've had stress at work. That suddenly brings up all this bloating, acidity symptoms. And today, irritable bowel syndrome has become the bane of this generation.
I will tell you my experience. The day I don't get proper sleep, if I stand on the weighing scale, I'm 2 kgs plus. I don't know what happens, but then, suddenly the whole pattern changes and my overall, bloating is like multiplied. So I think it usually happens very often to people who don't have proper health management, or, they're not able to take care of themselves, or they don't have proper sleep. So I think everything just comes together and, plays a big role.
When we tell people, that it's just sleep which is the cause for your weight gain, they laugh at us. How can simple sleep? But if you see that people who work in call centers, for example, right, they are awake at the times when their bodies actually said go to sleep. Or people who travel across the world,
right?
They're eating time zones, because the body has its own diurnal rhythm. When it slows down its metabolic rate, when the time to rest, and again wakes up in the morning. And that's how your hormones work. Now, when you play with your system, that's where the current generation faces problems which the past generation didn't face. We always feel there was less stress. There was less competition for various things. And that probably is, they had more time for family. They had more time for themselves. Today we are all running, trying to be somewhere without actually being there.
Correct. Absolutely. Right. You're absolutely right. So, Doc, you have been awarded as best surgeon in the world for metabolic and bariatric surgery. What is metabolic disorder and how can it be corrected? So
metabolic disorder or syndrome X was a term which was coined for various non-communicable diseases. Type 2 diabetes to begin with, fatty liver disease, a MASH or MAFLD. First it used to be called NASH and NAFLD, but nowadays it's MASH, is metabolic associated steatohepatitis, and MAFLD, metabolic associated fatty liver disease. Today, the largest cause of cirrhosis in the world is not because of alcohol, not because of infective hepatitis, but because of MASH, obesity, right? Then hypertension, dyslipidemia or lipid intolerances, previously we used to have gout as part of metabolic
Right.
syndrome. Now, of course, it's not really that significant. But these various things were called metabolic syndrome. And that is why various obesity associations across the world changed their names to being called from bariatric to metabolic surgery.
Oh, okay.
Because like I love saying, it is that one Ramban Shastra to tackle all these diseases or control all these diseases. These are chronic diseases. There's no simple solution. You can add one pill, you can add one injection, but there's never a U-turn. If you want a U-turn on your metabolic highway, probably bariatric surgery looks like the answer if you're obese.
So tell me something. If you're just eating healthy, you're eating normal, but your metabolism is slow in general, will you still gain weight?
This perception about stigma around obesity is such a huge thing, right? Invariably, people forget it is not that individual's lack of discipline that has caused that person to put on weight. Yeah, quite often we see someone who's put on weight. Oh, ye to mota hai, ye to exercise nahi kar raha hu.
That's the first perception that people form.
And that stigma actually is so pervading that eventually the individual himself or herself starts believing that weight is my mistake. It's definitely not. And that's the first thing that a lot of people start crying when they come to consult me, is only because I tell them this is not your mistake. And then suddenly they look at their family and then they say, see, this is what I've been trying to tell you all along. Amongst a family, if one sister is obese, they almost start developing an intolerance or a attitude problem towards the other sister
Correct.
who's thin, or the mother who's thin. And for no fault, the mother's actually trying her best to make sure that her child is not, because that's how society is, right? You are looked down upon. A stigma, weight stigma is associated at workplace, in the healthcare system, at a societal level, even in families.
Right.
Right. So we as society need to do something really significant to dispel these myths around weight. It's not an individual's mistake. Rather than support them, have empathy for them rather than sympathy.
And support them, because sometimes you never know, they may be suffering with thyroid or any other health disorder. And it could not be purely laziness, because every time weight gain is associated with either you're lazy or you're eating a lot or you're not moving yourself completely. So these perceptions actually kill their self-image so badly that, they start having a lot of confidence related and self-esteem related issues.
See, it's perception, right? Your show says perception.
Yes.
It's what is perceived. Every individual starts blaming themselves for their obesity, when actually it should be way beyond that. They should actually, if a obese person lifestyle, perception and beyond should be their caption.
Absolutely.
Right? So at healthcare, they are quite loath to seek healthcare solutions soon, because they feel they'll be stereotyped into a certain weight stigma, which is even prevalent with healthcare individuals like myself. The next thing is, they don't stick to any kind of solution that you recommend them, because they always feel there's no hope. Itna try kiya, I might not lose that weight. The other thing is mental health issues, right? So they are having body type issues, they are having anxiety, depression, even suicidal tendencies, and that gets worse. And then any kind of chronic stress, this puts them in chronic stress. Any kind of chronic stress is definitely not the solution for a weight problem. That was for the worsens. And that's why stigma, I think, plays a huge role in these people not
in
really
fact,
getting
a
better.
lot of people who have put on weight because of XYZ reasons, because of health reasons. And when there is a comparison that happens in the family, we've always noticed that there is always something associated with their mental health sooner or later, because when there is so much of very obvious comparison, not just the family, but the relatives, the friends, and they may not even directly say, they would say something which is like a very satirish kind of a thing that, okay, kitna khaoge, and, all those
Snide comments.
It really kills
hurts.
people. It
Yeah,
hurts
it
people
hurts.
so badly. And we had one person who had come on my show, and then she said that I am not able to lose weight. It's my thyroid condition. It is my health condition. But then everybody keeps telling me that ab to patli ho ja, ab to weight kam kar. So, it just, I don't know. This is like a never ending syndrome.
I've sat in interviews, news interviews and various other things, and I've operated on some individual. And we never talk about who we operate on. And that person says that, I've done yoga with so-and-so, I've done this diet and this gym routine, and then I've lost weight. And I'm sitting there at the other end and I'm smiling. And the news reporter eventually says, but you say that only surgery works for such and such. But this individual says that they manage. I said, some people are lucky. And eventually when we get out of the show, that person says, thank you. But it's not, people believe it's not macho to say they've had surgery. So this factor of putting surgery as, oh, it's not correct to have surgery, I think that's because the stigma again associated with it. Most people believe it's a short-term solution, which we should do away with. It's a life-changing solution. And that myth, once we get out, then we'll have far better results with weight management. Today, everybody in the world is talking about infertility. So many cancers linked to obesity in chronic use. So I think we need to start getting out these public awareness campaigns in India, especially with the Prime Minister talking about obesity. The Fit India movement should talk about individuals who've tackled obesity at various fronts and let them come out in front and speak about this.
And I think there should not be any taboo where people judge you because you do certain things. So if you engage a doctor for your health in any way, whether it is mental health or physical health, and if you are talking about it openly, I think people should break that bias, first of all, and understand that anything that you do for your mental health or your physical health is for your good, and also to create that or set an example in the society that it's normal.
No, WHO's definition of health is overall physical and mental well-being of an individual. We forget the mental aspect. In India, going to a psych or a shrink is supposed to be, oh my God. Yeah. People look down on, we started coffee with Mufi because coffee is my favorite drink, as you did see me drinking one. And this was a support group meeting I started in 2004. The intent of this meeting was to bring out people with obesity way back then, to come out of their closets and say, there is a problem. And Coffee with Mufi, why? Because it was a platform and nobody judged you. You came, you sat with people who struggle with the same kind of issues like you, and you were okay. You laughed, you played around, you were open about what troubled you.
Correct.
So that was the intent. It started before Coffee with Karan. Unfortunately, Coffee with Mufi didn't get the brand tag. Maybe I need to consult you for that.
Absolutely. And now I want to ask you something which is like the hot topic, everywhere. And I know, and you also know what we are talking about. We're talking about Ozempic. And a lot of people have started feeling very excited that we have got a solution to lose weight. And is this truly a solution? And is it approved by the health, decision makers that, this is something that is a go-to solution for people who are not able to lose weight and they want to become like absolutely fit?
So I'll tell you the facts. Okay. I am excited with the advent of some of these drugs. Ozempic is something that you named, but there are other molecules as well. So all our club does obesity management medicines, OMMs today. There's tirzepatide, there's semaglutide,
Mounjaro.
Mounjaro is tirzepatide and Ozempic is semaglutide. It was available, semaglutide is available in tablet form. Ribelsis is the name in India. We don't have the injectable form yet, though it's available abroad as Ozempic and Wegovy. And Mounjaro just got launched in India. I am super excited about these products, okay? Because like I said, it's an epidemic. And those who seek solutions for obesity, bariatric surgery, are less than 0.01% of the total people who actually are indicated for surgery. A lot of people go in for the drugs. Before that, the drugs we had were not as effective. Today, you have a serious chance at losing 15 to 20% of your total body weight loss. But again, it's a tool, right? It'll have side effects. Like any other drug does have side effects. But the thing is, can you sustain it? It's not like a short-term fix again. If people who are taking this drug for body image issues where they want to lose 5 or 10 kilos, I am going on air to tell you, please don't do it. You are messing up your system. This is not a drug meant for you. This is a drug that has to be treated for serious issues with weight, like diabetes. It was a drug that was positioned for diabetes, and higher doses was recommended for obesity. So please, please, please don't take and don't be trivial with the use of this drug. All long term, you will have side effects. Yeah, it's a safe molecule. You can take it. Please consult a proper doctor before you take it. It has to be taken in doses, which has to be stepped up gradually. If you get side effects like nausea, vomiting, which are enhanced, it's only because you've taken it wrongly, or the person who's prescribing to you has taken it wrongly. So I think it's a silver lining in our fight against obesity. Probably not the last arrow that has been fired on obesity. Probably not the best solution that will be eventually there, but it's a great hope for those struggling with obesity and diabetes. So please, please don't think too much about it. Ask your doctor whether it's the right molecule for you, whether you should try it. And since it's available and it's now relatively cheap in India, I think you should give it a shot.
And we keep hearing and we keep reading about Karan Johar and Kapil Sharma instantly losing weight. Even Oprah, she's lost weight. And every time this word Ozempic comes into the picture. So if somebody is doing it only for cosmetic purpose, what could be the side effects of Ozempic or any related drugs?
Elon Musk was the first one to tweet about it, right? He's gained back some weight from whatever picture you see. But sustenance, like in any weight loss battle, it has to be mixed with healthy lifestyle changes. Most of these people have become obese because they've somehow not had hormonal issues or genetic issues or anything, but their lifestyles have been their sleep patterns have been altered, or their food choices have been altered. So this has given them that hope. But for this hope to be sustained long term, they have to realize that they have to eventually go back and not make the same mistakes that they made in the past. Change their food preferences, change their lifestyles. So these are great advocates for weight loss rather than for Ozempic, I believe. If they've taken it, I don't know whether they've taken this drug, but Oprah and Ellen have tweeted that they've taken this drug. I don't know whether Karan and Kapil have agreed to taking this drug. But Kapil's, I've gone on a show once, and Kapil's very, very, you can say, has a great sense of humor. So I hope he does the show on it. Kapil, if you're listening to me, please do the show on the good and bad of Ozempic someday if you're taking it, because I think you're looking brilliant, my friend. But I think his health issues would have improved. He would have got far better. So don't do it for cosmetic reasons. If you have, like I said, 5 or 10 kilos of weight loss, there's the side effects like nausea, vomiting, GI side effects like constipations. Occasionally people get diarrhea, certain mood swings. They say theoretically there are issues related to pancreatitis.
Oh.
So if you've had issues with pancreas, please consult a proper endocrinologist or a proper physician before taking this drug. There is some link to thyroid cancer. Again, be very careful. It the way the molecule works is GLP-1. It slows down the motility of your stomach. So if you're planning to get pregnant, please stop it at least a month in advance, because there's no evidence of this drug being used or not used if you're planning for infertility. And if you're getting a surgery done, make sure you're off this molecule for at least a couple of weeks before you undergo, because anesthesia, your stomach slows down, you can tend to aspirate fluid.
So, Doc, can you tell me some hormonal shifts that can take place because of bariatric surgery? Because that's probably kind of misconception, or probably the reality that there could be certain side effects once you have bariatric surgery.
So I'll tell you with obesity, all right? Menarche, or when girls start getting their periods, is the first hormonal shift that usually happens, right? And because of them, those who are obese will suddenly realize that their estrogen levels are far lower in women. And in boys, their testosterone levels are far lower. Right? There's something called as a sex hormone binding globulin, which is produced at the liver. And there's a complex interplay. Another couple of hormones that you really need to know for obesity are your cortisol, and your ACTH hormone, which has a role. So a lot of people talk about the thyroid, right? The easiest for any lay person organ to blame is your thyroid. Oh, I've got a lazy thyroid, that's why I've put on weight. Please understand that even the most severe forms of hypothyroidism will never make you put on more than 8 or 10 kilos. Any weight of 40 or 50 kilos that you've gained weight is not, though you might have hypothyroidism, it's not because of your thyroid. In fact, the more weight you put on, that worsens your hypothyroid. And if you're hypothyroidism, you should ideally lose weight. When we talk about these hormones, if you're obese, it interferes with your menstrual cycle. It further produces insulin resistance, and that's why you get these black marks around your neck, or you get stretch marks on your tummy. That's called acanthosis. That is again because there's lack of insulin sensitivity at your muscles and your fat tissues and various other things. And at the liver level, there's insulin resistance. So you actually are producing a lot of insulin, and these black marks are just telling your body that you've got insulin resistance. And you're going towards type 2 diabetes. So these are your warning signs, right? Now with bariatric surgery, everything changes, right? There are different forms of bariatric surgery. And these new we spoke about Ozempic and Mounjaro. They are GLP-1. Mounjaro is GLP-1 and as well as GIP. So it's a combination of drugs. Now bariatric surgery, what it does is it completely alters a host of gut bacteria as well as gut hormones. When the gut hormone GLP-1 was actually looked at after bariatric surgery as a molecule for weight loss. So there are certain gut hormones that decrease gastric motility, certain that increase gastric motility, certain, like I said, there's a gut and brain axis where the signals play. They decrease appetite, and that's how these molecules work. So bariatric surgery, I think, is that Pandora's box that has opened up a lot of new perceptions and a lot of new thinking in terms of how obesity can be done.
Could there be any side effect, or there are a lot of people also who believe that, there can be, people can die when they get bariatric surgery done. So what is the possibility that that can also happen once you undergo a surgery like that?
The same way that bariatric surgery is never given credit for the ones that do well. Everybody loves blaming bariatric surgery for things that have gone wrong. Yes. So like any surgery, it has a percentage risk. Bariatric surgery done in best hands and in good centers has a risk which is less than 0.01%. That's the risk with gallbladder removal surgery, a hernia surgery, a uterus surgery. So it's the normal risks that you have. And especially in a group of patients that have got all the diseases possible, sleep apnea, diabetes, hypertension. So you'd ideally put them in the high risk group. But nobody talks about that high risk group. So people love, because it's a social issue, everybody loves reading newspaper articles that blame somebody dying out of bariatric surgery. It becomes public news. It is not that risky. Majority, you can say that 99% of the patients I operate go home the next day. Yeah, so that's the risk profile with bariatric surgery. It is very safe in good hands. There are long-term, sometimes caveats given to the surgery, like if any other surgery. Like you will have to take nutritional support. You will have to make lifestyle changes. You will have to take mental health support because there'll be body image issues which will play up. So far, you've been ignored and you've been shamed upon or stigmatized upon because of your weight issues. Suddenly your body is going to lose significant amount of weight and body dysmorphia will play. That's why we have counselors on board to actually tell people that these are the changes, accept them and move on with them.
So you do have patients who come to you with body dysmorphic disorders?
Yes, definitely. That's a huge role pre as well as post bariatric surgery.
So once somebody gets a bariatric surgery done, what happens? How everything changes for them? What is the step-by-step lifestyle change that one can expect? Not just lifestyle change, I would say physical change rather. What happens after the surgery?
So the most important thing is your diet completely changes after this. The way the gut hormones play, first is the stomach. Invariably, most bariatric surgery will decrease the size of your stomach. So your appetite goes for a toss. You don't feel hungry. There might be some degree of nausea, at least in the initial phase. Most bariatric surgeons will tell you that you will have to eat small, regular meals, at least for the first 3 to 6 months, and that's the lifestyle of that. A lot of patients who are on medications for anxiety, depression. These medicines are so powerful that they make them feel hungry. So that's why counseling is very, very important. And education of healthcare individuals is very important. To tell them that, yes, you have to decrease the medicines or you will have to eat more frequent meals. A lot of endocrinologists would struggle to realize sometimes, and physicians, that the amount of insulin someone needs would completely come crashing down. You don't need to use long-term insulin supplements in these patients because the need for insulin comes down. The diabetes improves dramatically after surgery. All the other medications will come down dramatically. The need for CPAP machines or BiPAP machines for sleep apneics will go down. Another big thing we tell our patients is, please don't try to get pregnant. They would have tried all forms of infertility treatment, everything to get pregnant. And bariatric surgery works miraculously on their infertility hormones in such a way that sometimes they don't use precaution, they get pregnant. And then they don't want to lose the baby because it's a precious baby. And we don't want them to get pregnant before 9 months to a year, because that's the stage where your body is breaking down on nutrition. So a lot of hand-holding and guidance is required for bariatric surgery. That's why I believe bariatric surgery should be done in centers that do this for a living, not in one-off Mama Chapa shop around the corner that says, "Chalo kar lete kal, aaj sikha hai, kal kar lete."
So, is this like a permanent solution, the bariatric surgery, that if you maintain your lifestyle, you will always have a good, like in terms of appearance, you'll be slim, or you will be like slimmer than what you used to be earlier, and you will never have a bounce back effect of what you used to be at one point of time, provided all precautions are in place?
So different types of bariatric surgery and where you start with. A super obese patient, now the super obese term has gone away, but any BMI of above 50 or 60 would find it that much more difficult to sustain longer term weight loss. So you need more radical surgeries. Depending on the type of surgery you've done and depending on what lifestyle changes you follow, there's a very good chance of sustained weight loss. So most bariatric surgeries, there are some who gain back all the weight because of unhealthy sugar eating practices, for example. But majority of the patients would manage to sustain weight loss, at least of 20%. That's where medicine gets its best results. Worst results with bariatric surgery is 20% total body weight loss. The best results with bariatric surgery are usually around 35 to 40% total body weight loss, which gives you, so they say that how much weight you need to lose for various diseases to go away. So they say that anything above 15 or 20% gets you increased quality of life, gets you rid of all the various diseases, and reduces the risk of having cardiovascular issues, reduces the risk of you having cancers and various other.
Amazing. So there's a narrative that obese individuals simply lack willpower. We discussed about this also. So from medical standpoint, or I would say psychological standpoint, how damaging can this misconception be?
This is a misconception or a conception, whatever you want to call it, which is scientifically incorrect and has profound long-term side effects, right? Not only for the health of an individual physically, but also for the mental well-being of an individual. Like we spoke about stigma, it all stems down to that. The moment you start blaming an individual for their problem and they start blaming themselves eventually, then it's the end of the day.
Very true. Very true. You also mentioned about digestive health impacting the mental health. How are these two correlated?
There are 100 trillion gut bacteria. Okay, they have an effect on hormones, on digestion of various food patterns, where they digest it. So any dysregulation, which can happen because of either mental stress or because of antibiotics or because of certain food patterns that you do change and take, or because of surgeries, for example. That will all lead to an entire syndrome wherein you hitherto didn't have problems and now suddenly you're developing lack of bloating, acidity, lack of sleep, all associated because of chronic stress that is related. So remember that these gut hormones produce certain hormones, like serotonin, for example. 70% of that 90% I can say of the serotonin in the body is produced by the gut bacteria. Dopamine, GABA. These are all gut hormones which are mood elevators and they interfere. That is why I believe that how do you solve this issue, right? So you need to get onto a plant-based high fiber diet. The moment you take rather than fruit juice, have the fruit. So the fiber comes along with it. Legumes, various other things. Sleep, because chronic sleep disorders are associated with dysregulation or dysbiosis of the gut. That goes up. Prebiotics, natural prebiotics like yogurt, kefir. Then you have bananas, you have ginger. All these produce very, very good results. So you have to stick to that. Avoid any kind of processed foods. Processed foods produce bad bacteria. So though you might reach out to a microwave because that's convenient, please try and resist from that.
Oh, is it?
Yeah. It's not the healthiest food you're getting. Any processed food. It's got high preservative content. It's got high sugar content. So you must try and avoid it as much as possible. Sometimes it's not convenient and we get into it. So try and sleep.
So you are a digestive health advocate. So can you tell me a little more about that? Because I've been, having a conversation with you and I've read a lot about you in that aspect. So can you throw some light on what are the kind of initiatives that you are taking?
Remember, your mind and gut have a huge role to play. Yeah. Today, India is the land of yoga. Don't do yoga for weight loss. Other than certain special types of yoga, yoga is never going to make you lose weight. Yeah. But it'll control your mind. Yeah. It controls your mind in such a way that the chronic stress you're putting on your gut system will come up. The next thing is sleep. Please put in at least 8 hours of proper sleep. And if you can't, for some strange reason, figure out ways of how you can do it. Have plenty of local fresh products. God has given our vegetables and our fruits certain colors. Enjoy the color. Don't deep fry everything. It's not meant to be had that way. Food are supposed to be enjoyed. The taste and texture of food is supposed to be enjoyed. And local, frankly speaking, don't go out just because one celebrity said, I've used kale and spinach from somewhere else. No. Hey, our local food has got very good nutrition and it's cheap and easy to consume. The other thing is have plenty of water. It kind of helps your gut. Half an hour of exercise would do you a world of good. Yeah. So these are basic things. Remember, I always love saying this. Eat your breakfast like a king, your lunch like a noble, and your dinner like a pauper. We do it completely the wrong way around.
Absolutely.
Our dinners are our heaviest meal. That's when your body is saying it's time to go to sleep. You need to slow down. We have late meals. All of us are guilty of this and we go to sleep. Eat your meal. The Jains do it absolutely correct. Eat before sunset. Eat your meal at least 3 hours before you go to sleep. It allows you to digest. Don't have heavy meals that you can't digest before you sleep. I think if you keep these basic mantras, I think you'll be pretty okay.
And what about people who are into intermittent fasting and, different kind of diet patterns that they follow? So is that also correct as per their body type, or there should be one kind of system which predominantly works for everybody?
Just so many different types of diets. Let's start with the intermittent fasting, like we said. I had put out a post recently saying that in Ramadan, in Lent, during Paryushan, you fast, right? What are you doing? You're shocking your body. For that 1 month, you're shocking your body, or 40 days, you're shocking your body into starvation period. Very good. Very good for your body. It allows you to reset your body. But again, you have to see whether your body system works. It doesn't work long term. What any kind of deprivation of your body will do is allow your body to reset its own cycle. So body goes into starvation mode. Starvation mode causes your body to conserve energies. The more often you do it, sometimes your body gets used to it and say, "Arey, ye to hamara hi hai." So it doesn't work the second time around. Short-term results are very good because it decreases your calorie intake. Your insulin levels get regulated. Your diabetes levels get regulated. Keto diet. Ketosis, it shocks your body into ketosis. So it's got a lot of fat, a lot of protein, almost zero carbs. Now, chronic carbs deprivation will lead to its own sets of problems. You can't sustain it for too long. Those with kidney issues have to be very careful that you don't overdo this. So please take medical consultation with that. Then there is the vegan diet, for example, or the blood group diet. One of the problems with that is it's not, it's good to take it, but vegan people will have B12 deficiency, calcium and iron deficiency, protein deficiency, because a lot of vegan foods don't really have B12 or a complete amino acid chain that gives you the amount of protein you take. So then you have the paleo diet or the Mediterranean diet. Every diet you do is popularized by a celebrity.
I think the best diet is dal, chawal, roti, sabzi, your salad, your dahi, and you're sorted.
Best diet is have all food groups.
Correct.
But in moderation. And eat it at the right time. Have your carbs during the day. Decrease your carbs at night. Have complex carbs rather than simple carbs. So what do I mean by that? Have multigrain chapati. You have jawar, bajra, very healthy grains. Have that because it breaks down later. So it sustains the amount of nutrition you take. And that's why you don't go in for sugar. Sugar is that one toxic substance that we never really talk about. And that's what is doing a lot. It's like a cocktail that is really putting your body down a path which you don't want to go down.
Very true. And those who think that even gluten should be avoided, is it a rule for everyone or is it specifically for some people who are allergic to gluten, allergic to certain kind of food? That's also a big confusion that people have in their mind.
It's popularized by certain Western cultures, right? A lot of our Bollywood friends have gone there, suddenly realize they're gluten intolerant. So you've had it from childhood.
I know.
You don't overnight become, like I said, a lot of food intolerances happen because of dysbiases in your system. You've not slept well or you've not taken the most healthy diet and suddenly you do a food intolerance test, you realize you're gluten intolerant. There are certain people who are born with gluten intolerance and that will come up in kids who are. But in adulthood, if you become gluten intolerant, just blame it on the dysbiosis with your bacteria in your system. You can always reset it by a gut reset program. You can treat your leaky gut where permeability through the gut happens. It's not a permanent thing. You can always set, unless you have it in childhood where you are either milk intolerant or gluten intolerant. And that most of the good pediatricians will pick it up early.
So doc, how do you deal with patients who come with unrealistic expectations? I'm sure you must be coming across such people also. Mujhe aisa bana do or mujhe aisa bana do, mujhe, I want to look like Katrina Kaif and all those things. So how do you deal with such people? Because I'm sure a lot of counseling must be coming into picture and you have to set their mind right before they actually go for any kind of surgery.
My job is to tell them to look beyond the perception of their own body image, show them a mirror and say, I think you're far better than Katrina Kaif the way you are, right? And you will never be able to look. She might have her own set of issues looking the way she does. So please don't put yourself in her boots and not put her in your boots. Show them a mirror as to what is possible, what is realistic, given their lifestyle, given their age, given what they are coming with. And I think then once they understand that, then I think you have realistic expectations out of anything, then I think they do quite well. Yeah.
But that mental setup has to happen.
It's very difficult, right? Sometimes they don't like me at all and they go to another doctor who probably shows them unrealistic expectations. My job as a doctor, I've been trained to do that, is to show them realistic expectations. Then the people who are unhappy with me decreases, right?
What about obesity in kids? Because today this is also a very common problem that because they don't have too much physical movement, a lot of screen time, lot of unhealthy food habits, and that leads to obesity and kind of sometimes mental health issues also. So do you deal or do such patients also come to you?
Yeah. Kids and obesity is a huge problem because today, like you correctly said, outdoor games have been replaced by games on computers and they are having a huge, not only mental, but learning issues as well.
Correct.
They're developing glasses at a much earlier age than we ever did. What used to be a necessity for us has today become a luxury for us has become a necessity for them, right? Today, food groups have changed. Dal, sabzi, roti, like you said, has changed into ice creams, pastas, and pizzas. So I'm not saying take your kids away from all this. I'm saying give it to them
Moderation.
like a gift over a weekend and tell them this is your award or reward for whatever you've done. But stick to basic healthy eating throughout. Sugar. Sugar is the biggest evil. Sugar, we don't seem to realize that we give kids sugar right from the time. Cereals. Cereals contain a very high amount of sugar. So when you're giving our kids, they're not healthy. Look at the back, read the amount.
We as parents believe that cereals are far more healthier than giving them
That's the biggest
parathas and all the other things.
No, parathas is far more healthier than a cereal. You read the back. If it's got anything like malt liquid, malt sugar, all that is sugar. Any form of sugar. People tell me, oh, I'm not having white sugar, I'm having brown sugar, or I'm having this other form of sugar. Now, I've always believed that sugar replacements like stevia and various other plant-based are bad in the long term. Short term, yes, but long term, they're bad. And now WHO has come out with a statement saying the same thing. So sugar replacements are not really good. Because what happens is, if you realize someone who's on a sugar replacer will reach out to that one extra piece of cookie that you have just to satisfy the hedonistic center in the brain that tells them you need nutrition. So long term, it will produces obesity somewhere.
And what is the age group that comes to you in terms of who's the youngest patient who has come to you so far?
Youngest patient I've operated is a 13-year-old. I was quite reluctant actually. I sent the patient out. I counseled the parents. We counseled the child, everything. But eventually the parents came to me with this child weighing 160 kilos, strapped with an oxygen.
160?
Yeah. With oxygen onto his ears, could not walk. Hypertensive, was on anti-hypertensive medications and various other. And then I operated. So a lot of these metabolic diseases start early in adolescence. And that's why we have kids that are becoming unhealthier and having serious diseases like diabetes, hypertension at a much younger age than ever used to happen in the past because of chronic societal apathy towards recognizing obesity as a disease. And even governmental policies are not ready to define obesity as a disease so far. And it's time we start thinking that way.
And we need to realize as responsible people that, the more we give them access to certain things, they will always love to go for shortcuts, and kids don't like to play unless and until they have always had that kind of lifestyle and, that kind of, environment that they see, around. So if your parents are not active or they are always on screen, your kids will also, follow the same pattern. So I guess it's like your whole ecosystem in the house has to change accordingly.
We've done a little split at DHI where DHI is Digestive Health Institute, which where we've tried now to reach out in schools to these kids and actually make them tuition their parents and to saying this is healthy nutrition. Because as a parents think it is absolutely okay to have sugar, it's absolutely okay to have a lot of high calorie food. The kids don't know any better, and that is what they perceive at home. Whereas when they are tutored in school now to recognize a fruit rather than a fruit juice, it gets better and better. So I think it is a parental responsibility to educate the kids on healthy nutrition. I think sleep again. Kids don't need to stay up watching serials or shows or YouTube or whatever. They need to sleep on time. Kids need more sleep than adults do. So remember that the younger your kid is, that many more hours. If an adult needs 7 or 8 hours, kids need at least 10 hours of healthy sleep for them to be healthy individuals.
And also, I think in terms of environment, the family itself also needs to be health conscious when it comes to being physically active, when it comes to eating right, when it comes to avoiding that much of screen time. Because if the environment is not, conducive to make the child adapt certain habits, nothing is going to change, because just giving instruction or ordering or, shouting at children to do this and do that, it will not work unless and until you change.
No, you have to be the example that the child follows.
Absolutely.
Kids always think that their superheroes are their moms and dads. Yeah. And I think if a kid grows up not following the mom and dad, I think somewhere the blame should lie with the parents.
And also the patterns. We have to break those patterns, because if you are of a certain body type and your child is also of a certain body type, other than the genetic issues,
Right.
I think if that is happening to your children organically, then there is some fault in your lifestyle, which you need to alter.
Genetics loads the gun, and we can't choose our genes, right? That's what we are born with. Environment pulls the trigger. You can avoid the environment, you can't avoid your genes.
True, very true. So, Doc, as someone who's seen how weight impacts confidence and self-worth as well, how important is it to pair bariatric surgery with image consulting or counseling for a holistic transformation?
I think very, very vital. I think those people who have been chronically obese have faced so many societal issues, weight stigma, body image issues, like anxiety, depression, and various other things, that when they rapidly lose weight, they're going to have those mental health issues that have still not receded, right? A lot of depression kicks in because suddenly you're looking at yourself in the mirror and you look like you've lost weight.
But does that also take a toll on the mental health?
Because they are very fragile emotional because of the issues. They've allowed their bodies and their minds to believe that they are going to be the neglected lot in the family or in that relationship. And that is why sometimes some studies have shown a higher uptake of suicidal tendencies or a higher uptake of divorce patterns after a pandemic. Because suddenly this person has emerged out of this shell and is seeing a totally different life around it. And the partner or the other person is actually looking at that person in the same mold. What has happened to them? What has happened? Suddenly woken up to be a different human being. So that's why counseling is very, very important. We also need to counsel them throughout that journey that don't abhor your body. We can do things with that body. Mentally, how to adapt to the changing environment around the new lifestyle, new health patterns and everything. I think that's very, very vital. So I think image consulting should be a part of any kind of weight management program.
Absolutely, absolutely. All right, doctor. So we have one last question, which is breaking the mirror question. And I would like to ask you that what are the myths that you would like to bust around the quick fixes that people like to go for when it comes to their health and well-being?
Health is a marathon. It's a lifelong thing. As long as you're going to live, your health is always going to be something that so treat your body like a temple. Yeah. The same way you want your temple to be clean and neat and everything, the same way your body should be healthy enough to sustain the various things that are thrown at you throughout your lifestyle, right? Right, from childhood to adulthood, the stresses and what you're exposed to is going to change. So it needs a more holistic lifetime approach rather than short-term fixes. Short-term fixes don't have solutions. Right? Short-term fixes, it's like today the whole world has gone towards T20. We love T20. It's got all the drama, the glitz, and you ask any true-born cricketer what he likes the test cricket. Because it's the longer version, it's the more authentic, the true version. So my advice to all these, the next gen or the Gen X or whatever, that few years later, you are going to say the same things that this generation of us does believe, that sustainability is the buzzword, whether it's in climate change or it's in products we use or anything. The same way sustainability of solutions for your body need a more long-term approach to it rather than a short-term approach.
And there are definitely no shortcuts when it comes to your own health, because everything has got to do with you, the way you live, the way your physical and mental health is. And of course, when it comes to your digestive health, that becomes a very important aspect of connecting your digestion with your mindset. So that's something which is very, very important. And today, doctor, this was a very informative conversation. Thank you so much. And this conversation will go a long way, because even I personally feel that there has been a lot of learning for me personally. And once again, thank you for all the insights that you have shared.
Thank you. Thank you for inviting me. Pleasure.
Today's conversation with Dr. Mufazzal Lakdawala was a deep dive into the truths about weight loss, digestive health, and the future of metabolic wellness. From debunking myths about bariatric surgery to uncovering how a healthy gut can transform not just our body, but our mind as well. Dr. Mufi reminded us that true wellness isn't just about losing kilos, it's about gaining a healthier, stronger life. If you're inspired to rethink your relationship with food, health, and healing, don't forget to like, share, and subscribe Perception and Beyond. Stay tuned for more groundbreaking conversations, because when we challenge perceptions, we unlock powerful new possibilities for our lives. Until next time, stay healthy, stay empowered, and remember, your journey to wellness begins from within.